Dr. Baliga here. This podcast is one in a series of 10 podcasts on the topic of falls in older adults. It's from an outstanding chapter in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. After completing this series of 10 podcasts, the listener should have a solid foundation in managing falls in older adults. This podcast is derived from an outstanding chapter authored by Dr. Sara M Bradley, who is an associate professor of medicine and geriatrics at the Feinberg School of Medicine at Northwestern University, Chicago, Illinois. Prior to this, she was an assistant professor of medicine and geriatrics and palliative medicine and the co-director of the Integrated Internal Medicine Geriatrics Clerkship for third-year students at the Mount Sinai School of Medicine in New York. The senior author is Dr. Reena Karani, MD, MHPE, who is the Senior Associate Dean for Undergraduate Medical Education and Curricular Affairs and Professor of Medical Education, Medicine and Geriatrics and Palliative Medicine at the Mount Sinai School of Medicine, New York. Her clinical interests include care of hospitalized older adult, perioperative management, and consultative models of care. Multiple choice question: which of the following is most likely to reduce in-hospital falls in patients who are at risk of falling? A. Raising up the four side rails of the bed. B. Having patients wear non-slip socks. C. Providing vitamin D supplementation to patients. D. Offering individualized physical therapy to patients. And the answer is D. Offering individualized physical therapy to patients. Multifactorial interventions for fall prevention have been shown to be effective in acute care settings. Commonly used measures such as fall alert bracelets, non-slip socks, carpeted floors, and bed alarms have not been shown to prevent falls. Raising up the four side rails of the bed have been shown to increase injury as limbs and bedclothes can get stuck in them. Patient education and individualized physical therapy have been shown to decrease rates of falls in cognitively intact hospitalized patients by 57%. On a separate note, what are the complications of falls? Complications of falls include fractures. The most common fractures are wrist, hip, and vertebrae. There is a high mortality rate, approximately 20% in the first year, in elderly women with hip fractures, particularly when they are debilitated prior to the time of fracture. The other complication of fall is fear of falling again, which results in loss of confidence and independence. Chronic subdural hematoma is another complication of falls that is overlooked and must be considered in any elderly patient presenting with new neurological symptoms or signs, particularly if they are on anticoagulants and blood thinners. Headache and a known history of trauma may both be absent. Patients who are unable to get up from a fall are at risk of dehydration, electrolyte imbalance, pressure injuries, rhabdomyolysis, and hypothermia. This podcast on falls in older adults was from an outstanding chapter in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's from an outstanding chapter authored by Dr. Sara M Bradley, MD, who is a faculty physician at Northwestern University Feinberg School of Medicine and Dr. Reena Karani, MD, Senior Associate Dean and Professor of Medicine and Faculty Physician at the Icahn School of Medicine, Mount Sinai, New York.